Hello to all dear viewers. Myself, Dr. Vipin Goel. I am a senior consultant surgical oncology and a laparoscopic surgeon at Care Hospital, Banjara Hills. Today, in brief, we are going to discuss about colon cancer. Intestine in our body are two. One is small intestine, one is large intestine. The food flows through esophagus, stomach, small intestine, large intestine and rectum. Anybody developing cancer in the large intestine, which is made up of ascending colon, transverse colon, descending colon and rectum, constitutes colon cancer. This is the fourth most common cancer seen in Indian scenario. There are two important risk factors for colon cancer. One, dietary habits, and second, hereditary. If somebody is eating more of the vegetables, fruits or high fiber diet, then the chances of patient developing colon cancer is low. Whereas the meat, red meat or high cholesterol or high fat diet is a risk factor for colon cancer. The colon cancer is also hereditary. If any of your ancestors like father, mother, grandfather, grandmother had colon cancer, then it is a chance you may get a colon cancer. How the patient of a colon cancer presents to us? Two most symptoms which everybody should remember is passing of blood in the stool and second, change in the bowel habits. Other symptoms for colon cancer are pain abdomen and sometimes vomiting and nausea. If the disease is confined to the colon, it is either stage 1 or 2. If the disease has spread outside the colon and the lymph node are involved, it is called stage 3. And if the disease has already spread to the liver, lung or bone, it is called stage 4. A patient of colon cancer, we do two things. One, colonoscopy and biopsy to diagnose the case. Second, CT scan of the abdomen and chest to see the staging, whether it is stage 1 or stage 4. In colonoscopy, we do examination of your colon by putting a camera through the anal canal and see whether there is any growth or polyp or infection which is the cause for pain or passing of blood in the stool. And if there is any suspicious, then what we do is through the same colonoscopy, we take a small biopsy and send it for testing to confirm whether it is a cancer or not. After colonoscopy, if the report shows it is a cancer, then we need to do the staging workup by doing CT scan of the abdomen to see whether the disease is confined to the colon or it has spread outside the colon. Treatment of colon cancer again depends on the stage when you have presented to the doctor, like whether it is stage 1 or 2 where it is confined to the colon, stage 3 whether it is confined to the lymph node, or stage 4 whether it has spread throughout the body. Treatment of the colon cancer depends on the stage. In stage 1 to 3, usually we start with surgery where the affected part of the colon is removed and the rest of the colon is joined either by staplers or by hands-on anastomosis, and the affected part is sent for testing. In stage 1, usually we don't require chemotherapy and only surgery will be sufficient. In stage 2 and 3, after surgery, we need to give the chemotherapy to reduce the chances of colon cancer coming back. What about the treatment for stage 4? In stage 4, usually surgery is not indicated. The treatment of stage 4 disease is only by chemotherapy where we control the disease. Surgery is indicated in stage 4 only for two indications. One, if the tumor is bleeding, causing fall in hemoglobin, or second, the colon cancer is causing obstruction, distension of the abdomen and vomiting, where the affected part need to be removed. So, the treatment for colon cancer depends on the stage. In stage 1, only surgery. Stage 2 and 3, surgery followed by chemotherapy. And in stage 4, only chemotherapy, surgery only indicated for obstruction and bleeding. After surgery, we call the patient in the first 2 years every 3 months, where we advise ultrasound of the abdomen after examination and a blood test called CEA. The CEA is useful for follow-up of the patient to see whether the chances of disease has come back or not. After we are confirmed that there is no recurrence on examination, ultrasound and CEA, we keep the patient on repeated follow-up and we tell the patient to come every 3 months for ultrasound, blood test and examination. If there is any recurrence, then we see whether the recurrence is only local or other part of the body. Depending on that, the treatment is started. What about the precaution usually we should take after colon cancer? The dietary changes, as I told, fruit, vegetables and high fiber are protective for colon cancer. So what we advise our patient is to increase the intake of fruits, vegetables and high fiber, and as much as possible try to increase your immunity. How we can increase by immunity is by doing regular exercises. The best form of exercise what we have seen is the yoga. We advise patient to either start doing yoga or do at least walking or jogging, which is very helpful for preventing not only colon cancer, other diseases also like heart problems and lung problem. The prognosis of the colon cancer depends on the stage when you have presented to the doctor. Like I told, stage 1, when it is confined to the colon and the lymph node and liver are not involved, the chances of cure are more than 90%. Stage 2 and 3, where disease has spread either up to the outside wall of the colon or the lymph node, the cure chances falls to 70%. And in stage 4, where the disease has spread to the other parts of the body like liver, lung or bone, we cannot cure, only we can control. Any of you have any of the symptoms which are suggestive of colon cancer, consult the physician as early as possible, because early stage we can completely cure you, and when you delay the symptoms and you present in the stage 4, cure is not guaranteed. Thank you for patience listening and watching the video. For any query you can put in the comment section. Thank you.